In today's Eye on Health, questions about the coronavirus pandemic, because we know that there are a lot of questions about this very thing.
So we're going to get some answers, and we're talking with Dr. Arvind Venkat via Skype this morning. He is an emergency physician at AHN. He is also the president of the Pennsylvania College of Emergency Physicians. And thank you, doctor, for joining us again to answer some of our questions.
Thanks for having me.
One of the first questions, we just reported this yesterday,
Right,
that they want to add to the number of symptoms for COVID-19 and adding that you will lose your sense of smell or sense of taste. Tell us about that. Why is that coming up?
So this is some new evidence that is coming up from our colleagues in ear, nose, and throat surgery, that they're getting reports about patients who report having lost their sense of smell and taste. It's early evidence, and we'll have to study it more to understand whether it really is associated with COVID-19.
And what about getting it a second time? There have been some rumors or reports that you can get it once, but can you get it a second time?
So the expectation is that if you've had this and you generated an immune response and got over it, that you will have future immunity, and that if you do get this again, it would be extraordinarily mild. This is one of the important scientific questions that's being studied right now to kind of relay to the public what their expectations should be.
You know, as a medical professional, I think you certainly have insight that we don't. How concerned are you about nationwide a reported lack of ventilators, a lack of hospital beds? What are you thinking right now?
So I think it's a concern, and I think it's something that everybody is preparing for, with the idea that we need to avoid this at all costs. And so what that means is that the most important thing is for all of us to practice social distancing and good hand hygiene, to allow us to conserve the healthcare resources that we have. But it is a concern, and it's something that the entire healthcare community and now the general public is worried about, and that we need to try and avoid at all costs.
Doctor, we just heard some extraordinary numbers from Spain about single-day deaths in that country, Italy, China. So when will we see our peak? I mean, do you think it's coming still? Have we hit it?
So unfortunately, I don't have a great answer for you. I think it's going to take time, and it's really going to be a reflection of how seriously we take these social distancing and isolation efforts. What we've seen in this country so far is that there are hot spots and that they're migrating. They're in different parts. Starting yesterday night, we heard a lot about Louisiana. I grew up in the Detroit area, and Michigan is a hot spot now. So it's one of those things where if we practice good social distancing, and we in Pennsylvania are hopefully ahead of this, we'll be able to avoid the kind of the real hot spots that have existed in other parts of the country.
Certainly people are watching China because that's where we heard about it first. And there in China, in the Wuhan area, people are being allowed to go back to work at this point. Is it possibly too soon? I mean, could there be another wave of this? How does that work?
So I'm going to defer to the public health experts to give a definitive answer. That's certainly something we want to avoid, the idea of a second wave. I think the most important thing to recognize is that if we practice good social distancing and we can flatten the curve, as everybody has heard about, then we can hopefully get back to work sooner rather than later, because we would have stopped the chain of transmission. But what the Asian countries have done, and that what we are trying to achieve, is to avoid that second peak. And what China seems to reflect is that if we do this correctly, and we do it effectively, we'll be able to hopefully go back to normal sooner rather than later.
I'm wondering, what are the repercussions of all of these shutdowns, the job losses? I mean, the public health crisis could come into a second issue down the road after all of this is said and done.
So it's absolutely a concern, and I'm not an economist, but just speaking as an educated citizen, I know from my interactions with various local businesses, it's an extraordinary concern. And it's even a concern in the healthcare system, because part of our response has also been to shut down elective surgeries, to limit the number of procedures, and that has an impact on the healthcare economic system that we have.
Right.
That's hospitals, physicians, EMS, but it's the entire community. And so this is a big concern.
Doctor, if you don't have any symptoms and you haven't traveled, you don't know anyone with this, is it okay for you to visit, for instance, your frail grandmother, or is it just too risky?
So there is some very early evidence that even without symptoms, if you have the virus, you may be contagious. On the other hand, the disease might be less severe than the cure, and that isolating the elderly simply because we don't want to put them at risk may put them at risk of other problems, other healthcare problems. As an emergency physician, I've certainly seen patients who they were isolated and they presented much later with disease than they should have. So I would encourage people to stay in contact with their family members, including in person. But if you have an elderly relative, certainly don't visit if you're having symptoms. And if you don't have symptoms, really wash your hands, maintain your hand hygiene, try to maintain your social distancing, but check on them.
And a big topic this week has come about pregnant women and transmitting the virus to their babies. I know that in New York, they've kind of put a lot of restrictions in place at hospitals.
The best evidence we have is that it does not transmit across the placenta, the virus, to developing fetuses, and that pregnant women and newborn babies are doing okay with this and not having any complications. But we need to be very careful in any hospital environment with transmitting infections.
All right. Thank you so much, Doctor. We really appreciate you answering some of our questions. And there are so many of them. I think they just keep coming as we continue to navigate this.
Yeah, we hope you will join us again because we appreciate your information, Doctor.
Take care, stay safe, and go from there.
All right, thanks. And we want to thank all the medical professionals. They are really on the front lines of all of this, doing so much good work to keep us safe and healthy.
Absolutely. They are heroes right now, always. And remember to keep watching our Eye on Health series right here on PTL. Happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.